Plantar fasciitis is one of the most common causes of foot pain that affects thousands, maybe millions of adults. Now, most of the time, the pain goes away in a few weeks or months, but for some people, it lingers for a long, long time. Are there regenerative orthopedic options that might help healing and recovery? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best, regardless of age or injury. Plantar fasciitis is tricky because the vast majority of the time it heals really with very simple things. This isn't really a video to talk about exactly what it is and all the sort of conventional treatments. I've got other videos on that, but just very quickly, it's sort of a degeneration of the tissue that holds up the arch, typically right off the heel bone on the inside of the sole of your foot. Hurts worse first thing in the morning with the first steps in the morning. And honestly, a lot of times rest will get it better or just activity modification, but things like night splints or stretching exercises, physical therapy can be very, very helpful to get it to heal. I would estimate somewhere 85% of people, just with very simple treatments, it gets better. The tricky people are the people that do all that and it's still lingering for 6 months or longer. That's potentially where some of the regenerative treatment options come in. Surgery is not, in my opinion, a great option for physical therapy, whether that's cutting the plantar fascia completely or trying to cut out the diseased tissue, reattach it. I'm not sure that that's necessarily the great way to go, and where potentially regenerative treatments might be helpful. Now, as I say in all of these modern medicine videos, all of the treatments that I'm about to talk about are considered experimental by the FDA. They're not covered by insurance. They're typically cash treatments and a lot of times expensive. So I'm not promoting them. I'm not pushing you to do them by any means. I'm just trying to put more information out there so that then you could talk to your doctor, talk to your orthopedic surgeon, and see if it's potentially right for you and get that treatment from your doctor, not trying to go online and buying peptides or doing something like that online without doctor supervision or prescription. So I've got other videos about how to get them and why. You can check that out. But as far as plantar fasciitis, there would sort of be two schools of thought. The peptides that potentially you would give yourself. And I think if I was going to expect that one might be helpful, it might be daily injections of BPC 157 somewhat near the plantar fascia to try to get that to heal. There are animal studies that show that BPC 157 can improve tendon healing. The plantar fascia is a ligament, but still sort of the same ultrastructure at a microscopic level. So potentially that might be beneficial to get it to heal. I'm not sure the oral form would do that much. Not really sure where something like thymosin beta 4 would play a role, TB4, TB500, but maybe there might be some benefit there. There's really not a lot of evidence looking at thymosin beta 4 for musculoskeletal injuries. But yes, could potentially something like BPC be helpful to get that to heal? It could be. Where I expect, especially in this chronic plantar fasciitis pain group, where it might be helpful would be injections done by the orthopedic surgeon into the defect, the area of degeneration within the plantar fascia. PRP is probably the most used and the most studied for that. But that could potentially be helpful. Something like stem cells or exosomes, albeit more studied for osteoarthritis, also could be helpful. There's just less data there. Real quickly before I sort of a side thought, I know a lot of times people will get cortisone injections into the plantar fascia in these chronic situations that it's not getting to heal. I would very, very much worry that that would actually make the problem worse and make the plantar fascia more likely to completely rupture. If it was me personally, and again, this is not medical advice, I would never get a cortisone shot, a steroid shot into my plantar fascia. That's where, yes, I would probably personally try PRP or exosome, something like that to try to get to heal. Again, not medical advice, not telling you what to do, but I just feel that steroids into tendons and ligaments are not a good thing. And that's based on a lot of science with tendons and ligaments throughout the body. But that's where, yes, in some people, honestly, not the vast majority of people with plantar fasciitis, but people with long-standing problems, maybe it could potentially be helpful. I'd love to hear your experience with your plantar fasciitis, especially if you've tried regenerative treatments for it. Leave those in the comments below. Just understand, if you leave a question in the comments, I can't respond and give you medical advice. So what I do is I try to answer that question in a future video like I'm doing here. Make sure to subscribe to this channel. Click the bell to be notified when I release a new video and when I start a new live stream, including my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.